Deputy Louise O'Reilly, please. The floor is yours.
Indeed, Cian Corla have very, very strong views, but sure, we could be here all day discussing them. Minister, there are a number of very pressing issues I want to address. I'm conscious that time is tight. I'm sharing time with Deputy Ward and Deputy Donnelly, 7, 4 and 4. So if we could maybe do ours within the 7 minutes, and if you can't then respond in writing, that's because I want to be respectful to my colleagues for their time, if that's all right. The first thing I want to say to you, Minister, is can you please today issue a directive to hospitals to ensure that nurses who went on strike, who fought hard for their pay increases, who deserve their pay increases, are going to get their pay increases? It is utterly ridiculous at this stage. Now, it's all very nice to stand in here and give them a round of applause, and, but I've said this to you before, nothing says I appreciate the work you do like decent pay and conditions. They fought hard for these pay increases, Minister, and I hope you'll be in a position to issue a directive today to say that they should be paid. I have two questions about nursing homes. The first one is to ask how many people have been seconded to the nursing home sector from the HSE to date. So you've given the figure of 200. I had a different figure that was given to me by the HSE, but I want to know what are the up-to-date figures, and I also want to know if you are planning on seconding a geriatrician or a geriatric consultant to work in any of the nursing homes. They've spoken to me, they say they're willing to do this work. Their expertise would be absolutely invaluable in this regard, and I think you should really look at that. The second relates to a decision to move patients from hospitals into nursing homes at the very, very start of this pandemic. So patients were moved from hospitals into nursing homes. Yesterday, on a conference call, I was told by the HSE that every patient that moved into the nursing home, they weren't going until they had 2 negative COVID tests. Can you confirm that that was the case from the very beginning? Because I tell you, I lost a relative in a nursing home. He died of COVID, but his family and the others in the nursing home are convinced that COVID came into their nursing home when the patients were transferred out initially. So Dr Houlihan last night appeared to row back a bit on that and suggest that maybe it wasn't all patients. So perhaps you could just confirm that for me, please. I have two questions on testing. Minister, I'm going to say this, and I've said it to you again, you really need to stop blaming people for the fact that they are, starting to, in some way, think about the relaxation. I think it was you and others in your government that put that thought into their head. There were mixed messages, and I know that work has been done to prevent that happening now, but there were mixed messages about the schools reopening. So I'm mindful of the view expressed by NEFIT, recorded in their minutes, that says all agree that testing and tracing is critical to tackling the virus spread. So we know that testing is important, we know that tracing is important. Can you state if the capacity is in place to move to disease surveillance testing, to move from disease surveillance testing, to actively testing in the community, so we can identify the total spread and transmission of COVID-19 and then contact trace every person who's involved? My second question is around the contact tracing app. Minister, I'm a big fan of the app. I want the app to work. I want there to be maximum buy-in, but let's be honest. You haven't exactly, you're not your department, your government haven't exactly covered yourselves in glory in relation to issues of data protection, particularly in relation to the public services card, but we need maximum buy-in. So can I ask that the data protection impact assessment be published well in advance, and that you allow organisations like the ICCL, like Digital Rights Ireland, and those who have an expertise and an interest in ensuring that this is done right, that you allow full input from these organisations? And my final question, Minister, relates to non-COVID mortality rates. Can I ask if there has been an increase in non-COVID related deaths compared to the same death rates for this period last year or other years? There is worry amongst patients' representative organisations that there may be significant health deterioration taking place and even additional fatalities, as data shows there is a significant reduction in people accessing health care. And can I finally say, Minister, I have two people very close to me who are at home cocooning. I would feel an awful lot more comfortable when they eventually can come out if all of the people around them were wearing masks. And can I ask, Minister, if you have a view on the wearing of masks in the community, and if you have a steady available supply of those masks so that we might all be able to comply? No, to go back to the Minister if we can. I had 7 minutes, please.
Councillor, how long have I got? Have I got 2 minutes? 3 minutes? Okay, thanks. So look, on a number of issues here, I'm going to write to you I'm going to write to you on some just in the interest of time as you asked me to. So in relation to the nursing home figures and how many staff have been redeployed, that's obviously a number that moves upwards and downwards. I saw a number of over 200. I know it was 61 last week, but I'll send you a breakdown by CHO. I do hope, and I don't want to build an expectation on this, but I did have a very good meeting on home care. I do hope that piece is also going to really help. There's a lot of work that they put into getting that agreement right, so I hope that will help as well. So I'll write to you in relation to that and on the issue of geriatrician. Sounds logical to me. I am conscious of the fact that we do have a geriatrician leading from a clinical point of view in this regard in the HSE, so I will seek her view on that. Look, on the issue of nurses' pay, yes, I've met the INMO on this as recently as maybe the last fortnight. My department have corresponded to the HSE clearly in relation to this matter. My understanding is 3,400 staff nurses have been appointed to this new scale in our public hospitals. That's up from around 700 in February, and around 220 have been appointed in our community healthcare organisations. But look, this is clear. There was an agreement in relation to this, and they need to be paid, and that needs to be processed. So we're very keen to see that processed very quickly. It is obviously noted that the contract's voluntary, doesn't require someone to complete an application process, but I want everyone who has applied to go on the payroll very, very quickly, and we have corresponded with the HSE, and I'll write to you on a timeline in that regard as well. On the transfers from nursing homes, from public hospitals or hospitals into the nursing home setting, and I sympathise with you in relation to your own loss. I'm aware of kind of the narrative or the question that people are asking in this regard. So there's a couple of things to say. I mean, the first thing is, let's remember, we were trying to move older and vulnerable people out of what was likely to be the surge setting or perhaps the danger zone in relation to acute hospitals to a safer place. So that was definitely the motive that everybody was engaging in. You're certainly not doing this, but I know there's a lot of people kind of saying, who brought the infection into the nursing homes? Was it staff coming in? Was it visitors coming in? Was it other patients? I think the reality is it's very hard to keep infection out of long-term residential care settings. I am assured by the HSE that testing guidelines and clinical assessment was carried out in all situations, but I'm going to confirm the question because I don't know the commitment that the HSE gave that there was 2 double negatives swabs. Was that carried out from what point in time? So I'll answer that in writing to you. And I would just make one point. Dr. Tony Houlihan does have a graph where he shows the time at which infection came into nursing homes versus the rest of the community. Certainly looks like an awful lot of those transfers would have happened long before that trend, and indeed that an incubation period would have passed. So that seems to be the general view. In relation to the issue of testing, yes, there is now a roadmap in relation to getting to 100,000 tests a week. That doesn't mean we'll be doing 100,000 tests a week. I'm conscious of not making the mistake other people have said in other jurisdictions in relation to this. There will be capacity to do 100,000 tests a week by the 3rd week of May. That's the 18th of May, outlined by the HSE. And I think we've sent your leader a briefing note on that this morning.
Mark Ward.
Thank you, Ceann Comhairle.